job.
Yeah, Mr. Chair.
I call the Honourable Member Yang Jen. Ni hao ma.
Ni hao, thank you very much. Now, Mr. Chair, I also would like to speak about National's commitment to growing and protecting our public health system. The Honourable Member Paul Hutchison has done an excellent job in elaborating some of those achievements. Now, we are committed to delivering a strong, reliable public health system for all New Zealanders. This commitment is illustrated by our investment of $14.1 billion for health, the most ever in the budget 2012. This investment is a clear signal that our national government is delivering on our priority of providing better, sooner health care services for all New Zealanders. Mr. Chair, as Honourable Member Paul Hutchison has just said, I'm very proud of national government's track record of delivering our health services. A recent OECD report said that out of 28 OECD countries, we had the third highest growth in health spending for 2009-2010, an increase of 3.1%. In real terms, compared to the OECD average growth rate of 0. This investment in health has led to better services and less bureaucracy. Also, there are a record number of patients now getting elective surgery, as Honourable Member Paul Hutchison has just said. 27,000 extra patients a year who are getting operations such as hip and knee replacements. These people who would otherwise be living their lives in discomfort are now looking forward to a brighter future thanks to Nationals. Now, Mr. Chair, we are offering better care for our cancer patients. They have access to faster treatment with radiation starting within 4 weeks for those who need it. Now, National has expanded this target to include chemotherapy. Since National came to power in 2008, no patient has had to travel to Australia for radiation treatment. Under Labour, some patients either had a 15-week wait for radiation treatment or had to be shipped to Australia because the health service was failing under Labour. Mr. Chair, under the leadership of National, New Zealanders can be assured that they will be getting the best medical assistance should they need the services of the public health system. And Mr. Chair, other significant improvements under National have seen record successes of emergency departments treating patients faster. 92% are admitted, discharged, or transferred within 6 hours. Record numbers of children immunized, 92% of 2-year-olds compared to 73% under Labour, and record numbers of smokers quitting. And we are not stopping there. We want to see more improvements so that New Zealanders have access to better, sooner health care. That's why 93% of under-6s can now see their GP for free during the day, compared to 70% in 2008. And this year, National has extended this to include free after-hours doctor's visits, and 90% of children or under-6 children benefit from this. This has been possible because National has invested $65 million in the zero-fee scheme over the past 3 years. And we are committed to eradicating rheumatic fever with the doubling of our spending of $24 million in this year's budget to fight the disease over 5 years. This includes school-based sore throat swabbing services involving 100 schools and 35,000 children to help with the early detection of throat infections which could lead to the disease. Just the other week, our Minister of Health announced that Auckland DHB would receive an extra $2.5 million over the next 3 years to improve productivity and provide more care for patients. That is good news. Now, Mr. Speaker, the National-led government is committed to building a brighter future for New Zealand. We are on track to achieve this. Thank you, Mr. Chair.
Mr. Chair.
I call the Honourable Minister Tony